Do you suffer from chronic inflammation that's not solved by medications or changes in diet or taking various supplements? Do you suffer from skin irritations or skin changes which are not clearing up with various topical ointments or taking certain kind of anti-inflammatory medications? Have you suffered and gone to various dermatologists and they have really left you in the dark, so to speak, with no help, no assistance in relieving your skin condition? I'm Dr. Lonnie Herman, and I'm going to share with you the results which I have shared in a previous video, and I'll put that label here on the bottom of the screen so you know the title of that video so you can find it, and you'll find it below my video on this, the description under this video. You'll find a link to that video. But you're going to see in the previous video where I showed the before care with me, which I'll put up the picture next to me right now. You'll see the picture of this woman's legs from knee down, the incredible discoloration and flaking of the skin. I'm also going to show right now the second picture where she had experienced dramatic relief after several visits with me, about 6 visits and to be precise, where she experienced dramatic relief from the discoloration and the flaking on and the so-called, you can just see here the changes of the two. I'll actually put both pictures up together so you can get a clear vision of what it was before and during the care. And right now I'm also going to show you the other video, the other picture, the final picture that we've taken of her legs after all of the skin irritation, skin disease has left her body. And I've been able to help her do this, and there was no other care that she went through. It was me, it was my unique care that I provided for her, where I was able to find specific infections in various tissues and eliminate them, and provide unique remedies that would eliminate them safely and get her to experience from before, during, and now after with 100% resolve of the skin irritations. Fascinating. I'm going to also put up here, which I've got my computer screen on my desk here as I film this video. I want to show you one key point that I discovered with her when I did my unique dental exam in her mouth. So I'm going to put this picture up on the side of the screen next to me, and you'll see this gold crown that was in her mouth. And this gold crown had been in her mouth for over 30 years. She had already gone, before she met with me, she had gone to a dentist to have the mercury fillings removed from her teeth. The dentist, who's a supposed high-quality biological dentist, removed all those mercury fillings that he could see on his exam. When I met with her, I said, I have a feeling you have something else going on in your mouth under that gold crown. I did my very unique dental examination with her, and I found underneath, I discovered that there would be, when they looked underneath this crown, that there was going to be mercury filling, dental amalgam, or you might call it a silver filling, as well as infection. Let me put up the next picture. And in this picture, you can see that there were, I've got some arrows pointing out here to areas around the tooth, but you'll notice with those arrows pointing, the arrows pointing, horrible, like a black, moldy, terrible infection that had been growing under that crown for probably 30 years or somewhere along the line of 30 years. Those infections just keep on coming out of the crown, swallowing those infections. You saw that big, black, moldy, disgusting appearing. And the dentist said there was nothing wrong with the crown, actually. And a previous dentist said there was nothing wrong with the crown. Let me pull up another picture, another angle that was taken of the picture when the crown came off. You could see much more of the dark discolorations, infection living underneath the crown. Well, those infections from what you see underneath the crown were part of the skin condition. We had to have that crown removed, cleaned up, get the mercury out of that tooth that was not visible on the dental x-ray, get that out of there, excuse me, and that was one major step in helping her clean up her body, okay? Dental infections contribute to skin conditions. Dental infections can contribute to inflammation in the body, as well as whatever other infections that were around her body. Let me tell you, in her in the examination protocol that she followed, that was the final, so to speak, I don't want to say nail in the coffin, that's not positive, but the final resolve of the skin condition. I found that she had, with my very unique bioresonance testing, no computer device, no electronic device, manual, hands-on, very serious and very effective method to finding what's causing the conditions in whatever tissue in your body and helping you remove it. I found she had an infection called mucor, which is a fungus in her lymph vessels. She had an aspergillus fungus in her lymph vessels. She had rhizopus fungus in her lymph vessels. She had ringworm fungus in her lymph vessels. She had a fungus called cryptococcus in her lymph vessels. I also, which I didn't share with you before, there was a root canal, which on a previous, I just don't have the picture of that, but there was a root canal that was infected with a jawbone infected, that we had to have that root canal extracted. I was able to actually use that tooth and find infections in that tooth and match those up to the lymph vessels, and we did that, and that was removed from the lymph system. I found staph infection. I could talk more with you on an individual basis about my work. I just want to get to the point here of what was found, and you can see the relief dramatic here, that staph infection was in her lymph vessels, Candida albicans in her lymph vessels. I found aspergillus fungus in her skin. I found staph infection with her skin, staph infection in her bones. I found also staph infection in the fascia. Fascia is tissue underneath the skin, wrapping around the whole body underneath your skin. You also have fascia in your joints. You have fascia by the nervous system. You have fascia around organs. Fascia is a very unique enveloping, an envelope-like material that covers all these tissues. When she went through this protocol, she came back into my clinic for her next exam. She's under my care also. She and her husband are very natural people. They are anti-medications, and they just believe in natural types of healing or helping their body heal naturally. She has breast cancer, and I will be putting pictures up of this. I'm not treating her breast cancer. I'm not treating her cancer at all. I'm going to be very clear about that. This is to remove the causes that will cause the body to not be able to heal itself from what we call cancer abnormal cells. She had a massive tumor with the breast, and we will be showing pictures in a later video. I will be showing pictures in a later video that will show you how nice it's shrinking. Very nice. But I saw her again July 6th. Today is July 19th of 2017. And the protocol that she followed, where I just mentioned the fungus and so on that was in her lymph and her skin and the staph infection in the bone, that she started in May of 10th of 2017. She came back to me July, and you could see here again, let me put the pictures up, before, what it looked like before she started care with me when we first started together, during, which was after 6 protocols, and then after the 7th protocol, which is the one that I just mentioned here. After that protocol, you could see how clear that skin, beautiful, all that skin irritation is gone. Whether you have psoriasis or a loved one has psoriasis or eczema or some other kind of skin condition, chronic inflammatory condition, I can help you find and eliminate the causes of the condition. Sometimes it's going to take us some time. Sometimes it's not going to be very quick and over in a few days or in a month or two. Sometimes it may take us a few months. Sometimes you have other contributing factors like dental work that can be contributing to a skin condition or any other kind of chronic inflammatory condition in your body. I'm happy to share with this successful presentation with you about this successful experience for this patient under my care, my very unique care. Let me put my phone number at the bottom of the screen here, 954-370-3100, or over to the side, wherever I do decide to put that phone number. You can even email my assistant and discuss with her what it takes to become a patient here in my clinic. The insurance companies, just to be very clear, insurance companies do not recognize my work. They don't get involved with this. There is no way that I can present to them what I'm doing and have them cover it. There is no insurance coding or billing that's available. With any insurance policy, any of them, whether it's Medicare, Medicaid, any kind of Social Security benefit, any kind of workers' comp benefits, any kind of HMO or PPO or any other policies, these insurance companies do not recognize this and they won't cover it. So this is something you'll have to invest in yourself. Hopefully it'll be very quick and your skin condition can be over soon, but you can, the point is, I can help you get well, and the work is being done, and here's proof of this. You will be meeting them with this person on a video on a later date once we get done with the other condition with her chest condition, breast condition. Like my page on my Facebook page, go to my Instagram also, as well as subscribe on my YouTube channel and be the first to find out when I'm putting up a new video. You'll get an email, you get a notification when my new videos are uploaded, as well as put a thumbs up, like this video, and let people know that you found it very useful and or incredible. If you've got some good comments, please put those below as well. I am here to help you get well. The job can be done, and let's get started.